So we're back to the thread on video remote interpreting. And in this video, I'm going to touch a little bit on the PowerPoint that I posted for last week that I posted without a video. Some of that information is included in this video, and it may become more clear to you if you had a little bit of trouble with that. In this video, I'm going to talk about the difference between doing a video remote interpreting assignment, meaning as I am here, you see somebody on screen and the interpreter comes up with a headset, etc. And what's the difference between that and doing on-site work, where you arrived to a staff meeting or a medical appointment or a parent-teacher conference, whatever the assignment is, I'm going to call that on-site interpretation. So first, to touch on the skills required to be a video interpreter. So most interpreters working in a video setting are highly experienced and highly skilled. And the reason is, although with technology advancement, there is an opportunity to tame using video, because you're working so independently and you have to make decisions on the fly or in the moment and juggle a lot of demands, not just dealing with the technology, but with the positioning and understanding the consumer in a 2D environment. It's really reserved for somebody that has experience and is a little bit more skilled. And so the interpreter should have experience in the settings that they are interpreting. So if you're doing video work, interpreting for a medical setting, it's going to be really important that you've already had medical interpreting experience in your on-site experience. And you have to be comfortable with working independently and being a decision maker. I want to touch on that as we move further on being a decision maker as you move forward. And what that means is, don't wait for someone to tell you what to do or for someone else to figure it out or leave things kind of unresolved. Be a decision maker and be assertive and take ownership of assignments, of issues, of trying to come up with a resolution, whatever the problem may be. And the other thing, as we've all come to learn, is we got to be tech savvy, because if your tech goes down, you're out of work, and there's no sick time for the computer, right? So we all got to be a little bit more tech savvy. So with on-site interpreting, this is what is typically expected of you. If a job starts at 10, you have to be there at 9:45. You're expected to arrive 15 minutes early, because arriving exactly on time is arriving late. And the reason why you have to arrive early is, if you're driving across the city, you may not be familiar with the parking, with where you're going, with the contact person, with the meeting location, etc. So unless you know exactly where you're headed, like imagine your first day of class and you don't know where the classroom is. Doesn't it take you a little bit longer to get there? Imagine that happening with every assignment as you get a different location to go to. The other reason that you want to arrive early is because you want to identify the consumer. You want to introduce yourself to the client, who, remember, in this setting, we're calling the client the paying party, or maybe the hearing client. So if you're at a medical office, you want to introduce yourself to the receptionist. Hi, I'm here to interpret for so-and-so. And maybe you want to find them in the room and introduce yourself. Hi, my name is Arlene. I'll be interpreting for you today. And the reason you want to do that is you kind of want to get a gauge for what kind of style their signing is, because you want to be ready. You want to know what you are going to deliver to them. But the other thing, let's say this is in a classroom or in a lecture hall or a conference, you want to position yourself. You want to go make sure you have seating at the front, a chair for the team interpreter, a spot to switch from, You want to make sure that you've gotten that position, and if you're there exactly when it starts, you're already late to position yourself. And so it's really important that you always arrive at least 15 minutes early because, again, as I said, if you arrive on time, you're already late. And so, why do we introduce ourselves? Well, it usually puts the consumer at ease. Oh, the interpreter has arrived. And it gives you the opportunity to establish some kind of rapport and maybe clear up any boundaries um, and understandings of your role as the interpreter to the client and the consumer. But the other thing is it gives you an opportunity to see visually what you're working with so that you know what range you're going to produce. The other thing is this is often when a consumer might ask you, oh, are you a CODA? Where did you learn sign language? What they're doing is establishing trust. How long have you been interpreting? So that's their opportunity to do the same for you. What kind of range are you going to give me? How qualified is your work? How experienced are you, etc. And when we position ourselves, we're really looking for the most clear spot to render the interpretation successfully. It's not just about the consumer being able to see me and the speaker, being able to look at both, but it's also about me being able to listen clearly and effectively, but also when, say, the speaker's pointing to something, I'm within that line of sight where I can kind of view what's going on. If we're in a location where no one can really see, I can't really see, or I can't really hear, I can't do an effective job. So when we're looking for our position, like the second bullet says, we're accommodating our own needs for what we need to provide a successful interpretation, as well as that line of sight for the consumer. So we now compare that to video remote work. We talked about you arrived at your workstation early because you don't want to have to restart your computer and your session or your start time for your shift starts at 10 a.m. and that's when you're restarting. And then it takes updates and who knows what before it actually comes on. So you want to get there early because you want to be able to answer that video call immediately. In your line of sight, this is the difficult thing with video work is that you have to identify the consumer and they're not always the very first person that you see. If it's a medical setting, you might see a nurse first. And depending on what agency you're working with or who you're working for, you might need to get patient information first before moving forward. You might need to get like an account code or whatever it is that's required. You might have to do a quick check for technical issues. And what I mean by that is sometimes your equipment's fine, but you can't hear them. Or maybe their sound is too low. You got to ask them to turn it up. You just want to make sure everything's clear before you start. Let me back that up. The other thing is if you first see a different person, example, as I mentioned, you see a nurse first, you're going to have to ask, can you please position me so that I see the consumer clearly? And you don't want them to just turn the camera and start talking. You want to make sure that everything's clear and then indicate that you're ready. And a way that you can indicate is by greeting the consumer and SimCom. Hi, my name is Arlene and I will be interpreting for you. Keep it short and simple, but indicate to everyone that you're kind of doing a greeting to prompt them to start. And so I'll give you a second to read that. So with video interpreting, the suggested view is obviously you need a clear view of the consumer because you want to be able to read their facial expression, body language if you're able to, like that kind of thing. Yes or no question. Sometimes people just head nod. Um, Sometimes the hearing person in that situation wants to also be on camera. And I always remind them, it's okay if you don't fit on screen. I need to be able to hear you, but I need to be able to see them. And it's really what works best for you. Remember, you have to think of yourself in this work setting because you have to advocate for yourself and you have to be assertive, be a decision maker. You don't want to get started with interpretation and then have to interrupt because you can't see or something's happening, but don't be afraid to do that because that's your job. If something's not working for you, stop. Make sure that the correct position is placed, and whatever correct is for you, make sure that it works for you so that you can really be successful at the work that you're providing. Because in the end, if you don't offer a successful interpretation, you don't want it to be for a reason that you could have fixed early on. You just want to take care of those issues immediately. So in the PowerPoint that I put up, it said it was a little bit passive voice where it said consecutive interpreting is primarily used unless it's sign language. That's because, as I mentioned in another video, video remote interpreting was actually started to be used with spoken language interpreters. For sign language interpreters, we primarily work in a simultaneous interpreting mode. But consecutive interpreting is a great tool to fall back on, especially when things are or complex, or even you have a consumer that needs a little bit more atypical um, type of style of interpreting, which means it needs a more highly visual way for you to communicate things. You might want to fall back onto this consecutive interpreting mode. So the National Consortium of Interpreter Education Centers, that's NCIEC, it did a research uh, paper on the effective practices of video remote interpreting back in 2010. And what they did was identify what are the challenges that an interpreter or a consumer may face working in this environment. And one of the challenges is managing the flow of communication. Because you're not there in person physically, both the hearing and deaf person may not be looking at your cues to indicate, give me a second, I need a little bit more time, or to indicate that you've not finished your interpretation. Um, and so they're missing, as that second bullet indicates, those nonverbal turn-taking cues, eye gaze, pointing, body language, and sometimes if either one of them points and you're not physically there to see what they're pointing at, makes your interpretation a little bit more difficult. So we're also missing environmental cues, other things going on, shuffling, people coming in and out that maybe you can't even see. And so you're not able to incorporate all those unseen things into your interpretation, which makes it difficult. It makes your interpretation pretty challenging because what you're able to produce gets a little bit more vague unless the language is very clear. So again, what do we do before you even start? Arrive to your station early, you take the call. First, you identify the consumer. Immediately check for those tech issues. Can you hear clearly? Can you see clearly? Is your internet fuzzy? I'm getting pixelation, etc. And then ask, can you please position me so that I can see clearly? I sometimes say, I need to be able to see his face and his arms, or I need to be able to see from about chest up. That helps the person positioning. It's usually an iPad. Sometimes they call it a cow computer workstation that they move around. It helps that person quickly position it because once they position it, they're not necessarily looking at the screen to see if it's successful and effective for you. And then proceed with your greeting and introduction. And all this has to be quick because sometimes customers connect and they want to get going and you're like, oh, hold on, I can't even see. So please, if you wouldn't mind positioning, etc. It's hard to give up control because that's what you're essentially doing. You're putting the control in their hands to position you, whereas you would normally be doing that on site. So this is just some examples of what you could use when a call comes in. Could you adjust the camera so that I can see the patient? I need to be able to see face and hands for facial expression and gestures. And after they move you, usually I simcom and I will introduce myself first. My name is Arlene. I'll be interpreting for you. Maybe I'll say, sometimes I work in Spanish, I'll say I'll be interpreting for Spanish, blah, blah, blah. And then I'll switch to say that in Spanish. And then I'll turn and say, I'm ready. You can go ahead and start. Oh, 1 second. Okay. Some things to consider is that if you're working for an agency and or provider, they may have a script that they want you to use whenever you answer the call. Like, thank you for using ABC video interpreting services, whatever their script might be. So it's a good idea if they do give you a script to kind of build confidence so it's just a natural flow when it comes out. Because if you're choppy, like I just did that, and it's you kind of hesitate on your script, people's reaction is like, do you even know what you're doing? Not that bad, but you get what I mean. It's a little bit awkward. Like you can't even get through the initial script to introduce yourself. And that's your opportunity, in all seriousness, to build that confidence with the consumer and with everyone there. Because again, this is a for-profit service and you're the business card of the provider. You're their frontline person. You're the first face that people are seeing and you're representing your employer. So you want to represent them well because that's how you can be a successful working interpreter. So once connected, how do you manage communication? I had this slide in the PowerPoint that I posted. Uh, Sometimes you have to indicate to them a simple okay, lets them know because they're seeing each other. They're not necessarily seeing you except for the deaf person. To let them know you can proceed. To the deaf person, maybe you've interpreted a question and they're kind of like, do a head nod. Like, go ahead. Um, and if they're signing, but you're ready to maybe you're doing consecutive work or they've given you a big chunk and you just have them hold 1 second so that you can offer your interpretation. I'm sorry, my slides are quicker than I am. Think about what else you could do to indicate that you're ready to render your interpretation. So here we are, the end of the session. A provider might have their own rules for you disconnecting. I worked for one provider that said under no circumstances do you hang up. And one of the equipment pieces that they were using, the devices, was a laptop. And they closed it like, so I was still connected, but they were done. That was racking up minutes for them because they bill often per minute. And I sat there for a bit thinking, I don't know how long I'm gonna wait here. But their policy, again, the provider, was do not, under any circumstances, disconnect. They have to disconnect. That was so long ago, I don't remember what I did. I think I may have ended up calling someone because, after a while, it's now who's being irresponsible. But you have to be aware of those rules and why those rules are created. Is it a customer service issue? Is it a billing issue? Uh, what's the reason behind it so that you could understand what you're doing? Usually, an interpreter doesn't disconnect a video, and this is true of video relay also. Is I don't tend to hang up. I let the deaf person hang up. It may be a little bit different with VRI because it's the hearing person who usually is controlling the technology, but I usually wait. Um, Unless they say, can you hang up? Then I'll go ahead and disconnect. Or sometimes I say, if you're done, I can go ahead and disconnect this. Just kind of so everyone knows we're going to be disconnecting. If somebody walks away from the screen, I don't assume that it's a disconnection or that it's over. Just kind of allow some time for them to return, and sometimes they do. Sometimes they forget that they've left someone on screen, and then they come back and realize, oh yeah, you're there, but I still need you, etc. Just again, because it's for profit, but also because we want to be the whole package. And now that I say that, including with VRS, we want to be mindful of customer service. So always make sure that the client is aware that you're disconnecting the call. So if they don't do it, maybe you say, I'm going to go ahead and disconnect if you're the one doing it. And maybe I add a wave, just a visual indicator that this is ending. So why do we ask? Well, it's video call etiquette. Because you're the service provider, you're the last person to disconnect something unless you're asked or unless you've indicated clearly that you're disconnecting. It's a customer service issue or service that you're offering. So you want to make sure that they're the party that's disconnecting. But again, going back to the provider, it may be a billing issue. For my example of racking up those minutes, I don't want to say that every provider is doing that, but it may be an issue of minutes. Again, my PowerPoint is faster than me. And the last thing is what is a provider policy? So that concludes this portion of a quick recap with the PowerPoint that I posted and just some differences on VRI work and on-site, but also the similarities. Those are important to understand. And sorry that my PowerPoint was faster than me. Thanks.